All right. Thank you for joining me. I'm Brian Banks from Your Career Day. Can you give us your name?
My name is Karla Cobb Hopkins.
Okay. And where's your hometown, Karla?
My hometown is actually a little town called Inkster, Michigan. So that's where I'm originally from, but that's not where I live now. I live now in Louisville, Kentucky.
Okay. All right. I know Inkster well, right down the street. So what is your career title?
Well, my career title is Psychiatric and Mental Health Nurse Practitioner, board certified, and I have a doctorate of nursing practice.
Okay. Now, what does your job entail?
My job entails some psychotherapy, but mainly medication management, psychiatric medication management. So I function in a role a lot like a psychiatrist would,
Mm-hmm.
with
Okay.
maintaining psychiatric meds for patients and, like I said, a little bit of psychotherapy.
Okay. Now, what type of education is required to do what you do?
Well, the minimum education that's required is a
Okay.
master's in nursing, and then a certification in psychiatric and mental health nursing. So as a nurse practitioner. So that's the minimum level. The
Okay.
doctor of nursing practice is an adjunct, but
Okay.
mhm.
Now, what is the best type of person suited to do what you do?
I think for nursing in general, the best type of person is someone who loves people.
Mm-hmm.
A people person, a person that loves caring for people, but can set healthy boundaries
Mm-hmm.
between themselves and the patients to provide the best care. So I think a caring people person.
Okay.
Mhm.
Now, what was your role to your current position? How'd you get here?
Well, I've been a nurse for 33 years
Okay.
total. So I've been a nurse for a while. I got my bachelor's in 89 from Tuskegee University. So my role has been a little bit varied and a little long. I've done
Yeah.
so many things in nursing. One thing that's interesting that I said I wouldn't do when I was in college from undergrad was that I wouldn't do psych.
Okay.
And then here I am.
Right,
So
right.
never say never. Um, but yeah, once I moved to Louisville, I started in psychiatric medication and I love it. And so then I kept going and got my master's and my doctorate. And here I am seeing patients.
Okay. Now, how do you know this was the career for you?
Well, nursing in general, I chose that when I was in fourth grade.
Wow.
I
Okay.
knew I wanted to be a nurse in fourth grade. My girlfriend's mom was a nurse. She came for career day and I was
Hmm.
smitten.
Okay.
So from fourth grade on, I kind of set my trajectory to be a nurse. So I volunteered for blood drives at the age of 12. Then I was a candy striper in the hospital at the age of 13 and just kept going.
Okay. Wow.
Hmm.
So that's interesting. You knew in elementary school this is what you wanted to do, and you pursued it right
Absolutely.
while you were young. Okay.
Absolutely.
That's great. Now, what advice would you give to someone that might want to follow in your footsteps?
What I would say is that, like I said, you have to like people.
Hmm.
You need to be confident
Yes.
in yourself. Nursing is a tough job. Nursing, actually, I think they've kind of rounded it out so that getting a undergraduate degree in nursing is one of the toughest undergraduate degrees to get.
Wow.
So
Okay.
you have to be tenacious, um, and you have to love what you do.
Hmm.
You have to be willing to kind of lay it all out there,
Yeah.
and yeah, be willing to do that. And so that's what I would say. People that love people, and you have to be tenacious and be willing to make the sacrifices.
Okay. All right. Well, Karla, I appreciate your time and really appreciate your, helping our viewers to learn more about psychiatric nursing. I didn't know much about it, so this is really helpful to me as well. And we wish you all the best moving forward.
Thank you so very much, and so nice to meet you.